Intro. Have you ever been in that doctor's office, super close to your due date, and you see that little flicker of concern on their face? That was us. We were at 38 weeks, just cruising toward the finish line, or so we thought. Everything had been picture perfect. The nursery was ready, the car seat was installed, our hearts were just overflowing. And then, at a totally routine appointment, our doctor got quiet while measuring my belly. He measured again. He said, "You know, things are looking a little smaller than I'd expect at this stage. I want to get a closer look, just to be sure. I'm ordering something called a biophysical profile." And just like that, the whole mood in the room shifted. A biophysical profile? We had no clue what that even was. My mind immediately started spinning through 1,000 worst-case scenarios. Is the baby okay? Did we do something wrong? The fear of the unknown is one of the hardest parts of pregnancy, and in that moment, it felt totally overwhelming. So today, we're breaking down the BPP test, the exact test that gave us the answers we so desperately needed. We're going to walk through what it is, why your doctor might order one, and exactly what they're looking for, so you can go in feeling empowered, not scared. Section 1. What the heck is a biophysical profile anyway? So, what is this test with the super complicated name? Honestly, the best way our doctor explained it was this: it's like a report card for your baby's well-being inside the womb. It's a non-invasive test, which is fantastic because it poses zero risk to you or your baby, but it gives your medical team a really clear snapshot of how things are going in there. The test has two main parts, a non-stress test and a detailed ultrasound. Together, they check 5 specific things to see how healthy your baby is. Now, why would you even need one? It's not something every single pregnancy gets. A doctor might order a BPP for a bunch of different reasons. Maybe you're past your due date, and they just want to make sure your little one is still happy in their temporary home. Or maybe you have a high-risk condition like high blood pressure or diabetes. Other reasons could be carrying multiples, noticing the baby isn't moving as much, or if there are worries about the amount of amniotic fluid. For us, it was because I was measuring small for my gestational age, which can sometimes mean the baby isn't growing as expected. But whatever the reason, the goal is always the same: get more information to make sure your baby is safe. It's usually done in the 3rd trimester, typically after 32 weeks, because that's when all these little signs become really good predictors of your baby's health. The whole point is to see if your baby is getting enough oxygen and if their brain and nervous system are working just right. Think of it as a full wellness check before their big premiere. Section 2. The journey begins. The non-stress test. I'm not going to lie, waiting for that appointment felt like an eternity. The anxiety was heavy. I remember trying to keep busy and telling myself it was normal to be worried, but it was tough. When we finally went in, the first part was the non-stress test, or NST. The name itself is pretty reassuring. Non-stress means the test doesn't put any strain on the baby. I got comfortable in a big reclining chair, and a nurse wrapped 2 soft belts around my belly. One belt held a sensor to track the baby's heart rate, and the other one recorded any contractions, even the tiny ones you can't feel. And then, we just listened. The sound of our baby's heartbeat filled the room, a steady, rhythmic thump 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 printing out on a long strip of paper. What they're looking for on the NST is to see the baby's heart rate go up when they move, just like our heart rate speeds up when we exercise. For passing grade, they want to see at least 2 of these accelerations in a 20-minute window. A passing grade is called reactive, and that's the good result you want. And of course, our baby decided this was the perfect time for a nap. For the first 10 minutes, there was barely a wiggle. The heart rate was steady, but it wasn't jumping up. My own heart, meanwhile, was going a mile a minute. The nurse, who was an absolute angel, told us this was completely normal and that babies sleep through this all the time. She gave me a glass of cold juice and had me change positions. When that didn't work, she used this little handheld buzzer against my belly to gently wake the baby up. It didn't hurt at all, but it did the trick. A few seconds later, a huge kick rolled across my stomach, and we saw the heart rate spike up on the monitor beautifully. 10 minutes later, we got a second one. We had our reactive result, and I felt like I could finally breathe again. Part 1 of the report card was a pass. Section 3, the window into the womb, the ultrasound after the NST. It was time for Part 2, the ultrasound. Now, this isn't your typical anatomy scan where they're measuring bones. This ultrasound is all about watching your baby's behavior. The sonographer put that familiar, cool gel on my belly, and for the next 30 minutes, we got to spy on our baby's secret world. This part of the BPP checks 4 specific things, and each one gets a score of 2 points if it's normal or 0 if it's not. First up, fetal breathing movements. This completely blew my mind. Babies don't actually breathe air in the womb, but they practice by moving their chest and diaphragm in a rhythmic pattern. It was amazing to see. The sonographer pointed to this tiny, barely there flicker on the screen and said, "See that? That's practice breathing. To get the 2 points, they need to see at least one episode of this that lasts for 30 seconds. Watching our baby rehearse for their first real breath was just magical. Next was gross body movement. These are the kicks, rolls, and jabs that you feel every day. They look for at least 3 distinct movements of the baby's body or limbs in 30 minutes. Our little one, now wide awake thanks to the buzzer, was putting on a full gymnastics routine. We saw arms flailing and legs kicking. It was so good to see that active baby on the screen that I'd been feeling for months. 2 more points for our little acrobat. Then, they checked fetal muscle tone. This is a much more subtle sign of well-being. Here, the sonographer is looking for the baby to do something like extend an arm or leg and then curl it back in, or to open and close their hand. We watched, holding our breath, and then we saw it, a tiny fist unclenched and then squeezed back up. It was such a small movement, but it was a huge sign of a healthy, working nervous system. Another 2 points. Finally, they looked at the amniotic fluid volume. This was the one I was most nervous about, since I was measuring small. Amniotic fluid is basically your baby's personal swimming pool. It cushions them, keeps them warm, and is critical for their development. Low fluid can sometimes signal a problem. The sonographer measured the single deepest pocket of fluid they could find. To get the 2 points, this pocket needs to be at least 2 centimeters deep. I watched the numbers on the screen, my heart in my throat. The measurement came back, 2.5 centimeters. It was on the lower side of normal, but it was normal. 2 more points. Section 4. The big reveal, getting the score. Once the ultrasound was done, the sonographer left to add everything up. That short wait felt so intense. We had seen all these great signs, but we were just waiting for the official word. The scoring is pretty simple. Each of the 5 parts, the NST plus the 4 ultrasound checks, gets 2 points for being normal, 0 if not. The best possible score is a 10 out of 10. A score of 8 or 10 is considered great and very reassuring. A 6 is borderline, and your doctor might want to repeat the test in 24 hours or talk about delivery, depending on how far along you are. A score of 4 or less is a major red flag and often means delivering the baby right away is the safest choice. Our doctor came back in, holding the report. He was smiling. "Well," he said, "looks like we have a very happy baby in there." Our final score was a 10 out of 10. Perfect. Every single marker was exactly what it should be. The relief was so huge it brought tears to my eyes. The NST was reactive, and the baby got full points for breathing, movement, tone, and fluid. Measuring small was just that, me measuring small. It wasn't a sign of a problem. This test showed us that our baby was, in fact, really doing great. CTA and conclusion for us, that biophysical profile was so much more than a medical test. It took us from a place of real fear to a place of complete reassurance. It can be so scary when your doctor orders one, but it's an incredible tool that gives everyone so much important information. It doesn't automatically mean something is wrong, it just means your doctors want a better look to make sure you and your baby are safe. It gave us the peace of mind we needed to actually enjoy those last 2 weeks of pregnancy, knowing our little one was doing just fine. So if your doctor ever suggests a BPP, I hope our story helps you go into it feeling a little less scared and a lot more prepared. It's a chance to get a special peek at your baby and a powerful confirmation that they're getting ready for their big debut. I would love to hear from you in the comments. Have you ever had a biophysical profile? What was your experience like? Sharing our stories helps so many other parents out there. And if you found this video helpful, please subscribe for more real talk about the wild and beautiful journey of pregnancy. Thanks for watching.